First of all, I'd like to talk to you about the key provision of this law, or what has seemed to have sparked the most debate, is known as the individual mandate, which requires all adults to buy health insurance either through their employers or by buying it themselves. Could you talk to me a little bit about your views on this provision?
Well, these reflect one's attitude towards whether it's constitutional and then the attitude towards the economics. I've primarily have considered the economics of a mandate. And in principle, a mandate can help overcome a free rider problem where people might not buy health insurance and then they go get care in emergency rooms or other contexts for which they can't pay, and to some extent the costs of that care may be shifted to other parties. So any economist says in principle if you force people to buy health insurance, you can reduce that problem. When you unpack, though, a mandate in practice, if you're going to have a mandate, you have to mandate that people buy something, and you have to specify the characteristics of what they have to buy. So it necessarily involves a considerable degree of government control over the underlying features of the insurance contract, which in this case extends the federal government into defining the underlying features of an acceptable insurance contract in all states, in contrast to our historical practice where the states have basically had most responsibility for making any kinds of determinations about health insurance. The other things that I find questionable about a mandate, one would be it's widely recognized that enforcement is likely to be imperfect. The mandate included in the Affordable Care Act, the enforcement has several features that would likely make enforcement less than perfect, including provisions in the law that say they're not going to really go after people that don't pay the penalties. The other thing related to enforcement is that the penalties themselves are quite small. They start out really small. Now, to be sure, after 3 or 4 years, it'll be $695 for an individual, up to 2.5% of a person's income, and family penalties will be greater than that. But the penalties themselves might be relatively modest, so as a practical matter, some people will avoid the mandate. The other thing that's really important about the mandate, enforcement, and penalties, however, is I don't think anybody believes that we can have a law that says people have to buy medical insurance without providing extensive subsidies or exemptions to people or low penalties so that people of modest means, who predominantly are people who do not buy health insurance, don't really get hammered by the imposition of the mandate. So if you circle back then to this free rider problem, the fact that people don't buy insurance, they may get care that other people pay for, my impression is that cost is relatively modest. And when you fold in what the law has done in terms of stipulating the mandate, the cost of subsidies, which will be paid by somebody, taxpayers in general, are going to be much greater than any benefit from reducing uncompensated care if you just look at the dollars. The other thing that the mandate involves as part of the overall law is that we're going to very much limit insurance companies' ability to, say, set rates based on age, which will, in effect, require younger people to pay much more for insurance than they would without the mandate because of these rating restrictions under the law. So to some extent, we're going to fund this subsidy delivery system. We're going to fund this procedure that's designed to get more people to have coverage by having young people face higher premiums than what they would if we stayed with the status quo. To be sure, many young people will be eligible for subsidies. So now they're going to face a product where they may get a premium subsidy, but they're facing a premium that, apart from any subsidy, is higher, perhaps significantly higher than what they would pay without this law. And overall, that tax subsidy package, the way that works, I think, is much more complicated and problematic compared to the simple view that if we mandate something, we can overcome this free rider problem.
And what is your opinion of the overall of the Affordable Care Act, sort of getting away from the mandate?
I actively participated in writing op-eds during the debate over the law, and I published numerous op-eds where I explained why I thought specific parts of the law were not in the public interest and that we could take an alternative, incremental approach to improve health care before moving in a fairly comprehensive direction as we did with the Affordable Care Act. The package that I believe would be appropriate if we change the Affordable Care Act, we get rid of the Affordable Care Act, would rely more on altering the system to improve incentives for consumers to consider the cost of their care, to shop for coverage, to be able to choose among insurance policies, and similar market-oriented changes. Now, just specifically, I think most people agree we needed to do something to improve the portability of insurance coverage for people that have insurance, say at work, and then they lose their jobs or they want to change jobs, and there's an imperfect mechanism for such people to be able to get coverage without being underwritten by an insurance company and thus face possibly high premiums for having adverse health conditions or pre-existing conditions. We could do many things to improve portability. One would have been a simple approach would basically have said if a person has been continuously covered by health insurance, then if they lose coverage at one work site or they somehow lose their coverage, they are able to get coverage without regard to health status and pre-existing conditions. Another thing I think we could have done to target people that for some reason don't get insurance when they're young and then later on decide that they may need insurance or they want to enter the market but they have adverse conditions or pre-existing conditions, we could have expanded federal support for state-run high-risk pools that would allow people to get limited coverage even though they have pre-existing conditions at rates that protect them from a lot of the increase that they would face in a perfectly private market. A third thing, and I think a lot of economists would agree with this, is we should have focused more attention on the tax code, which historically for people in middle to upper brackets has really encouraged them to accept compensation in the form of health insurance rather than the form of cash pay. And over time, the exclusion of the cost of health insurance from taxable income for people with middle and high incomes have encouraged them to load up on health insurance, which provides broad choice and has limited co-payments, deductibles, and the like. And what you're doing with that system is encouraging perhaps the most educated part of the population, specifically the most affluent part of the population, not to choose their health insurance with an even trade-off between health insurance and salary, but to get more health insurance, which discourages them from paying close attention to the costs and increase overall costs. The Affordable Care Act does do something. Beginning in 2018, high-cost plans are going to have to pay a 40% excise tax. I regard that as a step in the right direction. I'm not sure I would have endorsed the specifics. But as an alternative to the Affordable Care Act, there are many proposals that would limit the tax subsidy to health insurance in ways that would encourage people that are working with coverage to consider more carefully whether they want policies with higher deductibles and higher co-payments in exchange for a lower premium. And I believe it would also encourage many workers to be willing to voluntarily choose managed care arrangements such as health maintenance organizations that would have other mechanisms built in to control costs. If you offer someone a significant premium reduction for going into a health maintenance organization where they may need to see a primary care physician before getting access to specialists, with limits on the tax subsidy, I believe you'll see more voluntary choice of those types of arrangements. Now, I would just add to all that, when I view limiting the tax subsidy, there are technical details that can make it tough, but I think it would be very important to try to do that in a tax-neutral way. I certainly would not favor eliminating the tax subsidy for health insurance or limiting it if you didn't somehow provide some offsetting reductions in taxes. The short version there is I wouldn't endorse a tax increase without some offsetting reductions of other taxes if we move towards neutralizing the tax treatment of health insurance.
Mm-hmm. Now, what do you see as some of can you talk a little bit about the possible outcomes of the Supreme Court case? And given each one, where do we go from here?
The case, of course, is complicated. There are three main issues. One is whether the law is ripe for adjudication prior to 2014. Another one is whether the expansion of Medicaid inappropriately compels the states to participate. But really the central issue is the individual mandate and whether it violates the Constitution. I'd be surprised if the decisions that come down really relate to, I would be stunned if it related to the issue of whether the law is ripe for adjudication. I'm less certain about what the court will say about Medicaid expansion. Regarding the individual mandate, there are basically four possible outcomes. One is the court says it's constitutional, the entire law stands. The second is the court says the individual mandate is unconstitutional, but they let the remainder of the law stand as it is, including the insurance reforms, community rating, guaranteed issue of coverage, no underwriting for pre-existing conditions, the creation of health insurance exchanges, and the like. A third possible outcome is that the court says we invalidate the individual mandate, and because the insurance reforms are integrated with the individual mandate, and that the entire package really consists of an integrated whole, they get rid of Title I, which basically is all the insurance reforms, including the insurance exchanges. The fourth possibility, perhaps if they also frown upon the Medicaid expansion, is for them to declare the individual mandate unconstitutional and void the entire act, to basically say that the entire law is inseparable from the individual mandate. I would be surprised. I would say what's likely to happen? I would be more surprised than not if the court allows the individual mandate to stand and just basically says the law is okay. I think there's a good chance of that, but I'm inclined, based on reading the transcripts of the court and doing a little bit of court watching like other people do, I'm inclined to think that the court will declare the individual mandate unconstitutional. If they do that, I would be surprised if they declare the entire law unconstitutional. I wouldn't be astounded, but I would basically be surprised. I think given they invalidate the individual mandate, probably what we're going to get is they say, we'll isolate the mandate and everything else stands, or they will get rid of large portions or all of Title I, which is the package of insurance reforms of which the individual mandate would be deemed to be an integral part. So it's sort of in the ranking, I think. The two most likely outcomes are they repeal the mandate and either leave everything else, or they repeal the mandate and the related insurance reforms.
So, I mean, if they repeal the mandate and the related insurance reforms, I mean, what would you say is most likely to happen next? I mean, what needs to happen next? Does Congress and the Obama administration just completely go back to the drawing board? Is there a way to maybe improve what's there? I mean, what would you see as, where does healthcare go from here?
If the court were to invalidate the individual mandate but leave everything else stand, it's difficult to predict what the Congress might do for obvious reasons, especially given the election, and we might have a change of presidents. If the entire law were to remain but for the mandate, I believe it would be likely that the Congress would take legislative action to reduce some of the adverse effects of having eliminated the mandate. If the mandate is eliminated and everything else is allowed to stand, it will exacerbate the problem that's going to arise with the current law, which is there will be a disproportionate number of people in poor health that will comply with the mandate and seek coverage under the guaranteed issue and community rating of individual coverage. Now, we call that the adverse selection issue. Some people call it a death spiral issue. Because the penalties for noncompliance with the mandate are already low, I'm one of the people who thinks there will be a non-trivial amount of adverse selection which will put upward pressure on premiums in the exchanges and the individual coverage, that there will be strong cost growth because of adverse selection in those markets. The way the subsidies are designed, the federal government will end up picking up a large part of the cost if we do see that disproportionate risk selection and more sick people going into the pools. That will create more strains, obviously, on the federal budget and the deficit. So we already are going to have that problem to some extent. My esteemed colleagues like Mark Pauly and others, some people have said the mandate's so weak that getting rid of it probably won't matter that much. I have to think it'll matter. I can't quantify how much, but I think there's a difference between a penalty that could be 2.5% of one's income and no penalty at all, plus the ethical component of some people comply with a government law, an important government law. They don't look just at the penalty and do an economic calculation. So I think if we get rid of the mandate, the adverse selection problem will be worse. I think it probably will create enough concern that if we don't revisit the entire healthcare space, Congress will do something to limit adverse selection. which would involve allowing a window of opportunity for people to get coverage without being underwritten. And if they don't get coverage within a certain window, maybe they face potentially higher premiums if they have health conditions. There are steps that can be taken to limit the adverse selection. But I think much more importantly in the big picture, if the mandate itself goes, but everything else stands, it makes it more likely that we're going to end up with the overall structure of the law going forward, but for what could happen come November with the election. If the mandate goes and the health insurance reforms go, community rating, pre-existing conditions, limitations on pre-existing conditions, even eliminating the part of the law that would create state-based health insurance exchanges, I think that makes it more likely politically that some sort of overall alternative to the ACA gets legs in the Congress. Clearly, if the Republicans were to get a majority in the Senate and if we had a Republican president, certainly the campaigns are saying that we will do a repeal and replace kind of scenario regardless of what the court does. I think the court's decisions could influence the ultimate outcome.
Mm-hmm. And are there any initiatives currently in progress or things going on elsewhere that, you could see as a model, like in terms of that you think would work well? If there is going to be some adjustment of the law, or even if, given what would happen in the election, a complete rejiggering?
There have been proposals around for many years that I would describe as market-oriented, consumer-centric proposals for reforming healthcare. And I talked a little bit about this a few minutes ago. But no one in the political domain has really put out a hard and fast plan. It's all sort of generic. These are the broad points, but I think the broad points are good ones. And just sort of to reiterate, one thing is to look at how current features of legal environments that don't allow portability of coverage for people that have had continuous coverage, do something to allow people that have had coverage, if they change jobs, to be able to get coverage without facing significantly higher premiums because they've got some adverse health condition. We can do things to greatly improve portability. We've already got laws that enhance portability significantly, but there are gaps. We can close those gaps. The second thing I mentioned is think very carefully about the tax subsidies that exist that are especially pronounced for middle and upper income taxpayers to load up on generous insurance with free choice of providers, which puts strong upward pressure on costs. We can help reduce costs by rationalizing the tax treatment of health insurance and wages to make people more neutral about whether they want more generous health insurance with choice of provider, or they're willing to accept some restrictions on choice of provider and greater co-payments for their health insurance in exchange for getting take-home pay. Third thing, I think we do need to look very carefully at targeted areas where we can provide as a nation greater subsidies to people of modest means to get health insurance. Clearly, the Affordable Care Act, that's a major part of the act. There are less intrusive and less costly methods and more targeted methods of basically saying, how big do we want the safety net to be? How can we provide subsidies that will provide as few distortions as possible for incentives of people to work? But I believe even most conservative members of Congress and people that are running for office would be open-minded to an expansion of the safety net. Now, to be sure, given federal deficit concerns, it's a hard sell, and it's hard to think about how are we going to get the dollars. But if the Affordable Care Act were replaced, there is some room to maneuver to simultaneously think, can we provide more help to people with low income in order for them to get health care? And then the fourth thing, again, is people that fall between the cracks, end up without insurance, don't have the portability, they don't have continuous coverage, they need insurance, and now they've got a pre-existing condition that's very expensive to insure. Have a safety valve in place, expanded state-level high-risk pools, more federal money for those pools, but it's important to have some sort of penalty if a person waits to get coverage until they really need it. So you can't say we're going to give you coverage at the same terms and conditions you would get if you were healthy. I don't think that works, but we can provide some overall level of expanded safety nets. Now, the big picture, we have a big picture going forward is how do we help control costs and improve quality of care, or at least not reduce quality of care? One philosophical view is to say if we can engage consumers more in their decisions about their health care and their health insurance, that will over time create incentives that will help control costs. I think that it's worth it to move in that direction, to see incrementally. If we try a consumer-oriented model and we get benefits, we can see the benefits working, that would be terrific. If it doesn't work and we continue to have crises after crises with healthcare, then you can think about more top-down, centralized approaches to trying to limit the amount of care that's provided in order to make it affordable. I would just also add, regardless of how the ACA plays out, we're going to have a battle over Medicare funding, and we'll probably have a big battle over Medicaid funding. So even if the court allows the ACA to stand, and even if the election doesn't change the dynamics so that there could be a repeal of the law or a substantial modification of the law, sometime during the next 2, 3, or 4 or 5 years, we are going to have a major debate in the United States about what we should do about Medicare to make it fiscally sustainable over the long run. We're also going to have a major debate about Medicaid and how to make it fiscally sustainable at the federal and the state level over the long run. Those battles are going to be fought with tremendous implications for the future of the country, regardless of how the Affordable Care Act plays out before the courts or in the Congress.